Welcome to today's session. So just before we get into this afternoon's content, I just think it's important that we take a moment to acknowledge the traditional owners of the land across all of the places that you're joining us today. Here at the University of Tasmania, that's often the Palawa Pakana people. Respecting Indigenous knowledge and perspectives is something this university is committed to and something that you'll see throughout your time studying with us. But today we're going to start by talking about why you would study advanced practice. We're going to talk about the different options that are available to you, what study will look like for you as a student. Importantly, we're going to go through partner scholarships and what those mean for you who are already working in the industry. And then we're going to finish off by talking about how you can apply and what are some of the important things that you're going to have to cover in your application to ensure that you get an offer. And then finally, as I mentioned, we're going to go through any questions that you have. But now I'm going to hand over to Peter to continue our webinar for today and to introduce himself.
Right, thank you, Imogen. That's fantastic, and I'm very pleased you're all here today. My name is Peter van Dam. Just briefly about a little bit about my background. So a lot of my work is in health service improvement. My clinical background is nursing, and I've worked as a clinician for many years before I moved into academia. And I currently work very closely with the healthcare industry as well, looking at particularly improving health services, but also looking at creating new models of care and evaluating these models. So that's a little bit about me, but we can now go over to what the advanced practice course has to offer. So why study advanced practice? So the course itself, which has three components to it. So there's a graduate certificate, a graduate diploma, and a master's component. A lot of the courses and the specializations currently we actually have 16 specializations are co-designed with industry. So we really looked at what are the needs in the health system and how health service actually can contribute to the content and the curriculum design of many of the specializations. So in that way, really hoping that the content and the specializations align with current and future needs. And we had a lot of liaising and support with the Sydney Local Health District in particular, but also health service in Tasmania and in other states in Australia. And it's really designed for healthcare professionals. So, and this where many of the students come from are from clinical backgrounds, not only nursing, medicine, allied health, but also healthcare professionals who have gone into management roles and want to learn more about how to provide the best services possible. So the course is currently fully online, and therefore it offers a lot of flexibility around when you can study and how you can study. At master's level in particular, there's a what we call a capstone unit, which whereby you can undertake a project, a quality improvement project, for example, or a leadership development project, or you can also select a research pathway, and that research pathway actually articulates with a PhD if you were interested in further study. So three options we have available at the moment. So the graduate certificate in advanced practice, and there's two core units in that grad certificate. And the first one is critical thinking for health professionals. And again, this unit is co-designed with in industry, and it's really about how do you make this decisions based on the evidence? So there's a little bit of clinical component in it, but a lot of the content within that unit is around really providing quality services and making decisions based on that, but also making decisions around, for example, the right staffing levels and how you deal, for example, with serious incidents within your in your organization and collating that evidence and then making the right decision. So um, it's a unit which for the first time actually sits not in health but in another college, and that provides a really different perspective on how we can make the decisions. And I think one of the strengths of this course in particular is that we draw from units from all over the university, not only in health, nursing, and medicine, but also in education and engineering. And currently within the course, we have 80 units. So there's enormous choice for you to look at. And when you start at grad cert level, you have two core units, but then you have two elective units, and you can choose in that particularly grad cert, you can actually choose out of 30 units. So basically building your own course. At graduate diploma level, it becomes very interesting because that's where we have our 16 specializations, and I will go through the specializations in a minute. We started off with 8 specializations this year, but again, through liaising with our healthcare industry, we have developed other 8 specializations, so in total 16 specializations. And then I already mentioned the Masters of Advanced Practice, which has the research pathway and the capstone. Also, if you have a or hold a health-related postgraduate qualification, like a graduate certificate or graduate diploma or master's, you automatically will also receive credit for the graduate certificate level, which basically means you can actually start at graduate diploma level. So what are the entry requirements? So a minimum of 3 years experience in health, um, or a bachelor's degree in health-related discipline, or a bachelor degree in another field, and a minimum of 2 years experience in the health sector. So particularly the one where you have 3 years of experience in the health sector is something we look at sort of college level to see if you're actually meeting these requirements. It's not an automated process that your sort of experience will still be assessed. The other ones you will automatically have access to the course. Um, so graduate certificate, as I mentioned, 2 core units and 2 choice units. And then within the graduate diploma, you have 4 specialization units, which then you build up 50 credit points. And in the master's degree, you have 3 research units or 2 core units and 2 choice units, depending if you choose either the um, capstone pathway or the research pathway. So in total, 150 credit points. So here it becomes interesting because here we have our specializations, and as I mentioned, 16 specializations. And how do you choose out of 16 specializations is often the question asked. And so what we have done is we actually have themed them, and so the first one is more clinically oriented skills development. So 4 specializations under that theme. So critical care and retrieval, dementia, community and urgent care, and communicable disease prevention. And I'll go into a little bit more detail in the moment about these specializations, but they're more sort of, if you're more interested in clinically focused units and study, that's the way to go choose one of these specializations. The next one is quality improvement and economics. So there's an applied quality and safety specialization, health service improvement specialization, medication safety, and a governance specialization. The next theme is the education, culture, and digitalization. So digital health also will be provided for the first time in 2025. Then we have strategic communication, healthcare education, and workplace psychology. So then the last theme is services support and performance. So we have supply chain and logistics, organizational performance, health economics, and organizational resilience. So very briefly, I will go through the ones we're running at the moment. So the dementia, which is really about ensuring that people who suffer from dementia are provided with the right care and looking at systems and processes in order to do that. But also there's a little bit of there's some clinical focus around the disease process itself as well. Health service improvement is a specialization where you really look at how you improve the services within your organization. But more importantly, often we put in projects or interventions, but do we actually know how well they're doing, and are they actually meeting the key performance indicators? So in that specialization, there is a real focus on evaluating a new intervention or a model of care. Governance is really around the looking at structures and organizational connectiveness around quality and safety. What do you need to put in place to ensure that your organization provides the best care possible? There's a focus on monitoring and measuring performance as well. And what do you do if your organization has a shortfall in a certain area? And how do you put some interventions in place to meet the KPIs again? Healthcare education has two focuses. One is around clinical supervision and implementing clinical supervision within your organization, and the other one is around creating educational interventions for your colleagues and also how to evaluate these in the educational interventions. Do participants actually meet the learning outcomes you have set? Supply chain and logistics is really about how you ensure that your supply chain is safe, that it is reliable as well, and particularly during the COVID period, we know that it was really hard to secure a supply chain. So more related to non-clinicians, but more and perhaps more to directors of operations than clinicians. Next slide, please. So these are the new specializations. So applied safety and quality, and really designed to implement and evaluate interventions to improve quality and safety. And a lot of it's around evidence-based methodologies within this specialization, and very practical in nature. So the patients and the organization will benefit from students undertaking this specialization as well. Communicable disease prevention is really around surveillance and response to public health incidents. And of course, COVID is one of these big examples. And how do you actually deal with that? So it sits perhaps outside the acute care sector, but certainly people working in the acute care sector can learn a lot from the specialization as well. And community and urgent care is really around managing and curating pathways of care in predominantly primary and secondary care, and also with a focus on hospital avoidance. Critical care retrieval is a very sort of clinically oriented specialization whereby you learn the skills around airway management, ventilation, in with patients in very complex with very complex medical needs, and particularly in emergency situations, and how you actually retrieve patients from a very, if they, for example, are stranded on Mount Wellington in Tasmania, and how do you actually get them to in a safe way to the nearest hospital, which would be the Royal Hobart Hospital. And there's a lot around clinical reasoning and decision making. Digital health is around the key concepts of health informatics, and how do you ensure that your system is safe, and how do you avoid breaches within that system, and but also what are some of the social and economic impacts of digital health. For example, looking at my health record and the uptake, for example, by health consumers of my health record, and what do they do with that information, and how can that information actually help them to inform decisions around their own health. Health economics is a new specialization as well, and really looking at well, it's a first one. The first unit is really around sustainability and economic sustainability for health. The other component of that course is around evaluating health of economic impacts, particularly if you have implemented a new project, or you have implemented again a model of care, and now how is that model of care impacting on for example, the finance? Now, is it delivered in an efficient and effective way, and we actually reducing the cost in delivering that model? And then medication safety is really around, it's a multidisciplinary um, course where we really looking at how all healthcare professionals can contribute to a much safer way of administrating, prescribing, and and also providing medications to our patients, and really reducing the harm in. But we know that, for example, that medication errors occur, and that if we work together in reducing that we have much better patient outcomes. And organizational resilience is really around how do you have strategies in place, and and how do you manage in crisis situation, and it's around corporate security and particularly business continuation as well. And sort of designed, I suppose, for more for managers and leaders in healthcare organizations, but also outside healthcare organizations. You can also think about, for example, the aged care sector. So how are these courses delivered? So each unit might vary slightly, because, as I mentioned, the units coming from different areas of the university, but normally it's a mix of online classes and self-directed learning, and then uh, normally you will have about 3 assessment tasks per unit. And so the recommended time for doing one unit per semester is about 10 hours, which include also finishing your assessment tasks. The tutorials, most units have at least 3 tutorials per semester, but I know that many units have weekly tutorials, and all of these tutorials are also recorded and put online for if you can't attend, and you can watch that in your own time. There's often guest lectures involved as well, experts in the field who actually provide a lot of additional content, and a lot of the tutorials are also helping you to with your assessment task, and if you have any questions about, for example, the content, or not clear about some of the instructions online, these tutorials provide a really great platform to ask these questions. It's self-directed, so you can study any time during the day, any time during the week, and often there are discussion boards, interactive discussions, and you can complete to actually help you with getting your content, having better understanding of the content, but also helping to apply some of that within your own work environment. And each unit will have quite a significant amount of reading available, and you don't have to read everything, but there's certainly recommended reading, and the UTAS library provides these readings for you. And there are different assessment tasks, and we're really trying to move to making the assessment tasks much more pragmatic, and so that they actually really relate to your work environment, and that you can actually do something even, for example, if you are implementing a project, that you do a project pitch, and you can actually use that project pitch, for example, to one of the senior directors or the CEO of an organization, so making them very practical in nature. And so yes, it's a combination of some written assignments, PowerPoint presentations, or verbal presentations, and some quizzes as well. And it depends on which unit you study, but these are sort of the most common assessment tasks at this moment in time. And so also we provide master classes, and these are for free, and everyone who attends one of these master classes will receive a certificate of attendance, which you can use for CPD. The next one is in the stream of, or specialization, I should say, applied safety and quality, and that presentation is about patient flow decision making, and will be held on November the 12th at 4 p.m. You can enroll in these master classes online if you look up advanced practice and UTAS, then on that homepage all the master classes are listed. And then scholarships, so all our courses in the advanced practice under the advanced practice banner are provided under Commonwealth supported places, but on top of the Commonwealth supported places, you also are eligible for a scholarship if you working with one of our industry partners. But we have many industry partners within Australia, and there is a pricing document online as well, and normally will provide a reduction of 60 to 50%, 50 to 60% of the student contribution. So if you go to the website and you just look up your organization, you can find out what the exact price of the course is.
Beautiful. Thank you, Peter. So we've got a few questions. So if anybody listening has a question they'd like to ask, if you start popping it in now, we will get to those in a second. If anything that you've heard today sounds like it's something that you want to engage in for 2025, we're still accepting applications. Applications are so easy to do and they're free online. So I've included the application website for you on this slide if you want to jot that down while you're listening. When you jump on and make an application, you'll notice that they'll ask you about your previous study. And so for this, we're really looking for more of your bachelor degree study or anything that you've done past that rather than your year 11, 12 studies. So really focus in on that. Peter also mentioned popping down some of your previous work, or if you've got work experience that you'd like to add to your application, you can do this as well. Once you've submitted your application, there'll be an area in which you can attach additional documentation. And as Peter's just mentioned in the slide previous, there are opportunities to receive between 50 and 60% of your course offerings via a partner scholarship. In order to assess you for a partner scholarship, what we require you to attach to your application is simply your last payslip from your workplace or a letter from your manager. You can attach that at any time. So if you want to submit your application to get the ball rolling, you can absolutely do that and then pop back in once you have those additional documents to add later. Otherwise, we will reach out to you and ask you for them also. So we're always there to support you if you need it. Once you've received an offer, you accept this through the same portal that you applied through. And then once you've accepted, after 24 hours, you'll be able to access our system and enroll in your units. We are here to help you to choose your units. As Peter mentioned, there's quite a lot there. So you can reach out to the team as well via that phone number below if you start getting confused or you want some support in creating a study plan. Otherwise, there will also be enrolment sessions towards the end of the year and into the new year. And you can always join one of those that will guide you through the steps on how to do that as well. So now I'm going to go through all of our questions that we've got, Peter, quite a few. So the first one is chatting about what the career pathways are for someone that might complete a graduate diploma. This person's asked specifically for workplace psychology, but I wonder if you could talk about, Peter, if somebody completes just the certificate portion or just the diploma portion, what sort of career pathways that opens up versus perhaps going through and doing the full master's?
So I'll answer the question around workplace psychology. So workplace psychology is really around sort of the human resource management, creating a positive work culture. So people who are, for example, people managers within the organization or want to be people managers in the organization. So from a nursing perspective, you can think about nurse unit managers, assistant directors of nursing, for example, but also for allied health, it's very similar. Allied health directors, allied health managers, and again the same for the medical profession. So it's really around, I suppose, in a way, this specialization around people management and creating positive work cultures. And then um, within the course, and particularly at graduate level, there's also a leadership unit, and I actually forgot to mention that, and that's actually quite an important unit because you develop a leadership plan within that unit, which you evaluates after the 13 weeks. But you can actually take that leadership plan with you throughout your career and actually update that. So I think the course overall is really designed to move you into more sort of if you don't choose the clinical specialization, into more management and leadership positions, and they can be formal or informal leadership positions.
Perfect. So you have touched on this, but I think it's important to just reiterate, if somebody has already done a graduate certificate in a health-related field, what sort of credit can they claim? Can they go straight into the diploma? Can they go into the master's if they've done a health-related diploma? Can you just explain how that would work for somebody?
So we can provide up to 4 units of credit, so which is a graduate certificate. So if you have completed a graduate certificate or higher, then you can start at graduate diploma straight away. So you can actually skip that graduate certificate. But if you're interested in the critical thinking unit, for example, or the leadership units, which are the core units, we can also play if you have applied for the grad dip with some replacing these units with some of the elective units. So in that way, again, we're very flexible by building up your own course and looking what you're interested in.
And Peter, does that mean that if somebody's completed their certificate in a non-health related area, that there may still be a couple of elective units that they may be able to get credit for?
Absolutely. If they align with the learning outcomes from these electives, then absolutely.
Perfect. So someone just touching on whether or not the qualifications are free for existing healthcare workers. So I think it's important just to touch on that the discount that Peter has previously mentioned is between 50 and 60%. And that really just depends on what organisation you're currently working for. So you can go onto the Advanced Practice website and you'll notice that there's an area to look up your organisation and see which discount they actually offer. So we encourage that you go and do that because everyone is slightly different. There's a question here about when enrolment closes. So where I feel like we're very generous, you can apply and enroll all the way up to mid-February. So the course, Peter, I'm assuming begins when the standard semester begins, which is on the 22nd of February. I hope I'm getting that right, for next year. So you could enroll even the day before that course begins. Obviously, we do recommend it's much earlier because you then have the opportunity to log in and get comfortable and to meet your tutors and meet your lecturers and make sure that you are comfortable with the software. You can download the unit outline. You can start getting comfortable with what is going to be handed to you throughout those units. But Peter, did you want to expand on that? Is there some additional tips and tricks?
Yes, what I really would like to recommend is to apply at least 3 or 4 weeks before semester starts, because it takes the university a couple of weeks to get you sorted as well. So creating your email address, your login details, and also then getting access to the unit. So and the units also open 2 weeks prior to starting date as well. And so in that way, having applied earlier means that you just have much more time to actually get familiar with your study.
Yeah, that's exactly right. And enrollment is very straightforward. So if you can aim to do it, I think 2 weeks is a really great suggestion, Peter, because it does allow you to log in, have a little look around before your classes and your content actually starts and get familiar, because that's the first test, is really starting to look through your unit outline and planning it around your life, making sure that you can accommodate for it in your day-to-day. So someone's asked if they're able to stop at the graduate diploma level. So can you stop at the cert? Can you stop at the diploma and then not go to the masters? What does that look like for someone?
Yeah, you can start at each stop at each level. So if you say, for example, you have applied for the graduate diploma, but you think that no, you don't want to continue, you can actually exit after 4 units and receive a graduate certificate. And the same if you have applied for a master's, then you can also exit with a graduate diploma. So early exit is absolutely possible. But just coming back to that, so if you are working for a healthcare organization, we have a partnership arrangement in place, and you're still interested in doing the masters, you actually better to actually look at applying for the graduate diploma first, because that means the graduate diploma, with the graduate diploma, you will receive the scholarship. The master's component still does to have the HEC supported in place, but doesn't have the scholarship in place.
Yeah. And final question is around what happens if you enroll under one of the HECS scholarships and then decide to withdraw partway through? If you want to come back to study, will that scholarship still apply, or will you need to self-fund? So did you want to answer this one, Peter, or I'm happy to do so?
Um, that, so let me just have a quick look.
So my understanding is that what we would encourage you to do is not to withdraw from the course, but just to take a break. And that just means not enrolling in your next semester of units. If you don't withdraw from the course and you stay enrolled and you just simply take a semester off and then enroll in the following semester, your scholarship, HEC scholarship, will still apply. If you withdraw from the course altogether and then reapply to go back into it the following year, you'll absolutely get the credit for any units that you have completed. But whatever the agreement is with your partner institution at that time will apply. And every year they can tend to sometimes change. Sometimes they might go from 60 to 50% for an example. So you're locked into the partner discount that you have at the start of your qualification. So if you're ever thinking that you might want to withdraw, just always have a chat to us first about what that might mean for you, because we would probably encourage you just to take a break. Would that be fair enough to say, Peter?
Yeah, I think that's a great suggestion. Absolutely.
Perfect. So that is all of our questions for today. Thank you everyone for your time and for participating today. We really appreciate it. And if you have any questions, you can absolutely email us. We'll be sending out this recording to everybody as well. So we encourage you to reach back out to us if you have any follow-up questions. But in the meantime, thank you very much. And thank you, Peter.
Thank you.